Welcome to our Medisafe webinar on coronavirus. My name is Brian Carr from the Medisafe team. On behalf of the whole team, I welcome you to the webinar. Also joining me today is Marissa Brower, who leads our support team, and Dr. Daniel Sands, our Chief Medical Officer. I'd like to say that as we start, to emphasize the point, you are not alone. We have team members in the United States, United Kingdom, Israel. They're all here, and you can reach us at any time at Medisafe, support@medisafe.com. As we get started, I want everyone to know this webinar is not for medical advice. Please consult your personal physician for all personal medical advice. Also, please keep in mind this is a public forum. You probably don't want to discuss, chat, or ask questions that anything you wouldn't want shared. We are recording this session, so it will be made available upon request afterwards. And we do have some links and things we'll be sharing with you in an email afterwards as well as a survey to see what you thought of the webinar and what we can do to improve. Audio connections are muted right now, but we're going to ask you to ask questions if you could by hitting that Q&A button at the bottom. And you should be able to ask questions there. And we've got more than almost 100 questions that came in already for Dr. Danny, and we're going to get to them in just a minute. Dr. Sands is the Chief Medical Officer at Medisafe, and also the primary care and internal medicine physician at Beth Israel Deaconess Medical Center in Boston. He did want us to point out he's not an infectious disease specialist. So we'll get to his perspective in just a minute. We'd also like to tell you what other Medisafers in the community are saying. We did a survey that went out last week, and we have results we'd like to share with everyone. And Marissa and I will share some tips for using Medisafe, and also we'll get right to Dr. Danny's questions and perspectives. Very quickly, everyone, I mentioned we did a survey last week, and the overwhelming results worldwide from the Medisafe community were people are looking for updated information, worried about exposure, really wanted to stay connected somehow as we're in isolation, and said touching base is very important. And honestly, that's one reason we did this webinar, to reach out to the community, know that we're here for you. We're still there anytime in the app. If you have any questions or suggestions on what we can do better in the app, that's what we're here for. Anxiety is common, as you can imagine, in the Medisafe community. One of the quotes we saw was, we're the only people I see are my caregivers. I'm scared to death. They may bring it here to my home without knowing. That's a common refrain. We're all feeling this anxiety. If you look at this chart here, if you look at the second to last bar at the bottom where it says very concerned, that was last week's respondents. I'm just going to tap on this week's, and you can see how that has spiked already, particularly with what's happening in the US as we get deeper into it. We are concerned that coronavirus might interfere with our medication regimen. More than half of us are. That number has spiked again this week. It's gone even higher. A typical concern is, it would be very helpful to get any kind of advanced warning about med shortages that could occur. And we have some info on that later. And finally, I just want to share the good news and the heartening news in the Medisafe community is we do follow advice. Even from last week, more than 9 out of 10 people were responded to they're practicing social distancing. We are washing our hands more. And 68% said sheltering in place. That number's probably gone up a bit since then. But the questions remain, should I be spraying my groceries with a disinfectant when I get them home? So let's get to those questions in a bit.
Yeah, Brian, I just wanted to chime in about on that slide. 90% are saying that they're washing their hands more often. But one question I often wonder is, are people washing them more often or more effectively? And, washing your hands properly is really important. There's some great videos showing you with goo on your hands and things like that to show you how to effectively do that. People don't generally wash their hands well. So I think washing them effectively is more important than washing them more often.
Okay, and maybe we'll send a link out to that video afterwards for people that want to see it. We'll do that. Okay, thanks, Dan. So very quickly, just some quick tips on how Medisafe can help today and things you could do in the app right away. One of the things you could do right away in the US is use our new pharmacy service. This is available now in the app for most people. If you go to the More button there at the bottom of your app, and then it will bring up the menu, you can click on Medisafe Pharmacy Services. If you don't see it, you can email us at support@medisafe.com. It may be that you need an updated version of the app or something like that, but this is our pharmacy service. We have had a lot of people try it already. There's a quote from a person to try it, said it was far faster and more convenient than the traditional way of waiting in line. This will keep you sheltering in place. The meds are delivered to your home. There's free delivery. There's no annual commitment or anything. You can cancel anytime. You get the same co-pays as you pay now, where it's available in all 50 states and most insurance plans. And the good news here is if you tap that, we'll actually, bring your insurance card when you do it. We'll check your insurance first to make sure that it qualifies before we make you go through the whole process of transferring them over, and then you can make sure. And one other tip on this, don't wait till you have 2 or 3 days before your refill to do it. Ideally, you want to do it, a week or two ahead of time, because what we'll do is transfer it from your local pharmacy to our pharmacy. That could take 3 or 5 days as we confirm everything. And then in the app, you'll get a notification. Today's a day you can refill, tap it, go through the copay, and then it'll be shipped to you, usually 3 to 5 days, depending on where you live. We'll send you a link with any questions you have on it. You can take a look and see if it's for you. My suggestion, if you're still skittish about it, try it with one of your medications and see if it works the way you want, okay? All right, now I'm gonna turn over to Marissa, who's gonna talk about MedFriends.
Hi, everyone. A MedFriend is a friend or a family member that you can sync to your app in order to get reminders if they skip a med. It's great to help your loved ones keep accountable with their meds, and it's also great to keep yourself accountable with your meds. It's very simple and easy to use, and it's also free. This past week, we've already seen an increase of 40% of MedFriends, which we can attribute perhaps to the COVID-19. And it's a great support system, especially in this time of social distancing. So all you need to do is tap Profile, tap Invite MedFriend, and then you can send an invitation.
That's great.
Yeah, moving on to measurements. You can track over 20 measurements in Medisafe, and you can also connect your measurements with your Apple Health or Google Health app. In regards to COVID-19, this could be a really great resource for tracking your temperature or tracking your mood. You also have the ability to export your measurements and send them to your doctor, all without leaving the house. And to access your measurements, you just need to tap More in the bottom menu, tap Measurements, and then you can select your measurements and start tracking. Adding reminders. So you can also add lifestyle reminders. I know most of us are adding medication reminders, but you can actually add any kind of reminder. You can do it manually. So you just go to the same place that you would add a med, and you can type in a lifestyle reminder like wash your hands or check your temperature. And then you skip through the dosing information, and then you'll have the ability to receive reminders to remind you to wash your hands every certain amount of time.
That's great, Marissa. And that shows up in the reports too that you can send to your doctor.
Right. We also have a weekend mode. It gives you the option to delay your morning reminders on your selected days, which can be Saturday and Sunday. Unfortunately, this feature is only on the Android platform as of now. It is on our roadmap for iOS, and we do hope to support it in the near future, but for now it's only on Android. And to access weekend mode, you can go to More, tap Settings, General Settings, and then tap Weekend Mode, and then you can select your days and also adjust the time.
That's great, Marissa. And everyone, we went through that pretty quickly, but there'll be links to how-tos on how to do this for you when we send it out to the webinar. And let us know what you think. We're especially happy for our beta community friends. We've got about 500 beta community people who help us with testing things and getting releases out. So, if this is something you love on iOS, let us know too, okay? Thanks, Marissa, so much.
Yeah, of course.
All right, so again, let's reintroduce Dr. Sands as a primary care and internal medicine physician. Marissa, do we have some questions for Dr. Sands? Do you want to start?
Yes, we do. So we have a question from Linda, and she asks, if you smear Purell on the handle of a shopping cart, will it keep the handle free of the virus for a certain length of time, or can it become contaminated a minute later?
Yeah, thank you for that, Linda. first of all, I think it's important to understand that Purell is a hand sanitizer, and it's not really ideally suited for disinfecting surfaces. You want to use a surface disinfectant for that, disinfectant wipes, for example. The other thing is that most disinfectant wipes need a certain amount of time to act. So they're not going to immediately disinfect the surface. I mean, at best, you're going to get a 1 second, but if you look at the EPA's website where they actually look at these things, some will require 5 minutes of time to actually disinfect a surface. But my point is, if you use a wipe, use a disinfectant wipe of some sort or spray on a disinfectant, that's not going to protect you from it being reinfected. If someone actually had coronavirus on their hands and they grabbed the shopping cart that you just disinfected, yeah, that would get potentially reinfected. But I want to point out something, and this is a common, people are very paranoid about a lot of things in the environment. Can I get the coronavirus by being in an elevator that someone was just in? Or, or what about packages? And I know there was a question about that, and we could talk about that. And I think it's important to put things in perspective a little bit, because although the coronavirus has been retrieved from surfaces after varying amounts of time, depending on the surface, we don't have any actual cases where someone's gotten infected from that. So it's just important to keep that in mind. I'm not saying you shouldn't disinfect things. You definitely should. But I think it's just important to put things in perspective a little bit. So the answer to the Purell question is, you shouldn't probably be using hand sanitizer to sanitize your shopping cart. And yes, it's only going to have a limited time of action.
Okay, thank you. Another question we have from Jeff, and he asks, why do some people and other people don't have severe symptoms? So why do some people have severe symptoms and why do others not have severe symptoms? Do we know yet how long a person can be asymptomatic and still be infectious?
Yeah, that's a really good question, Jeff. We wish we knew the answer to that. It turns out that some people can have the disease and be really asymptomatic or minimally symptomatic. And throughout the whole time they have the disease, and maybe for a little bit of time afterwards, they actually could communicate the disease to people. And so that's $1 million question. We don't know the answer to that. We don't know why some people do that, but it does seem that it's more often younger, healthier people that can do that than others. But so far, and although the estimates are all over the map, it looks like it may be 20% of people may be asymptomatic when they're infected with this.
Okay, thank you. From Rita, we have another question. She says, I heard letting your fever get to 102 or 103 degrees helps kill the virus. Is that true?
No, sadly, that's not true. If it were true, we'd be treating people with hyperthermia. But unfortunately, there are all kinds of legends, myths out there about how you can get rid of it. And I've read so many of them. My own mother has sent me many of them. That she says, Danny, is this true? And no, unfortunately, none of these things are fixes that really work. And so be very careful. Some people have actually died because they think that, oh, well, I heard that this thing works, and then they take it, and then they get a complication and they die. This has happened because, there's been this, there have been some people who've been claiming that, for example, hydroxychloroquine works to treat coronavirus. It might, but the data is really not very good. But because people are latching onto that, some people have actually had tremendous problems because they're taking large doses of chloroquine or hydroxychloroquine and getting into complications. People have even died.
Okay, we have another question. This is from Rick and Roselle. What is the best way to clean fruit and produce to eliminate COVID-19? Can it live on frozen food packaging?
Those are all good questions, Rick and Roselle. A lot of people are asking these questions about how should I, manage the food that I bring into my house. And unfortunately, there's not a lot of evidence. So people may tell you one thing or another, but there's certainly not a lot of evidence. But let's remember what I said earlier is that we don't have any reports of patients getting sick from COVID-19 by handling a fruit. It just hasn't happened yet. So this is totally, totally theoretical. There aren't any standardized protocols or recommendations. I would recommend washing your fruit well, as you always do. If you want to be, I suppose, extra careful, you could peel all fruit. I don't actually personally think that is necessary.
Thank you.
Oh, and I'm sorry, I didn't answer the question about frozen.
Go ahead.
And I don't know the answer to that. I don't know the answer to the, whether you can, I don't think you can kill it just by freezing it. So I don't think that's going to really protect you. Probably boiling everything, getting it to a high temperature for, 5 minutes would probably kill everything, but I'm not sure your food is going to be that palatable if that's how you treat it.
Great. Again, folks, if you have any questions for Dr. Danny, hit the Q&A button at the bottom there and we'll get it to you. Danny, an anonymous person in the webinar has asked, how long does it usually take to recover for a healthy person? And I'll add a little bit, are there after effects, a week later that they need to still be concerned?
Well, the good news about this infection is that the vast majority of people have mild or minimal symptoms and they don't require any significant medical care. And so that's really good news, but it doesn't mean that a healthy person, as the questioner asked, is totally off the hook, because we do have examples of healthy people who are getting serious illness and need to be treated in the hospital. That said, the virus seems to run its course, unless you are really sick and develop complications. But in most people, the virus seems to run its course within a 10-day period of time, maybe 2 weeks. Sometimes people have a little bit of lingering symptoms afterwards for a little while, but no serious long-term complications. Now, remember, I said for people who have mild symptoms. People who have more severe symptoms, unfortunately, do have, in many cases, longer-term complications. So, it's important to keep in mind. But let's say, Marissa, God forbid, she get the COVID-19 infection, the likelihood is Marissa would do very well and would just have to be quarantined for a couple of weeks. And it's actually maybe more than a couple of weeks if she's still feeling feverish at the end of the 2-week period of time. But generally, the reason we say 2 weeks is that, the vast majority of people are no longer going to be infectious at that point.
Okay, Marissa?
I think
Yeah, I'm on mute. So if you've had COVID-19 and you're cured of it, can you get it again? Is it like the flu or a cold? We hear about herd immunity. Can it mutate?
Wow, that was a great question. Yes, the virus does mutate. It has mutated already. We don't yet know, we haven't figured out if people have long-lasting immunity to this virus. Obviously it would be much better for all of us if once you get it, you're done, kind of like chickenpox, although hopefully it won't go into hiding like chickenpox virus does, going into hiding in your body. But we don't know. That's the bottom line. I think that we don't know if you get long-lasting protection. And of course, this has a bearing on vaccine development as well. So more to come on that, as we learn more about this virus. Remember, the virus has only been around for, a few months, at least in the US. It was in China for a little bit before that. So there's an incredible amount of scientific activity going on. Papers coming out literally every day. And some of them are good, some of them are bad, and some of them are giving us great insights. And we're definitely moving the ball forward. But boy, it is a slog.
And then we have a question from Kimberly. She asks, is there an alternative way to test? The flu swab made my nose bleed, and I'm terrified to let them swab my nose again.
So the question about the swabbing, yeah, the answer is that there are new testing modalities that are being developed that are helping us detect this. So instead of doing a nasopharyngeal swab that that we do for influenza, for example. There are other types of swabs, even throat swabs, that are being developed and approved that may be good. There are even some situations where they're talking about self-testing. The problem with some of these is that we have to be darn sure that the tests are good enough. So in other words, if you do self-testing and you don't collect a good enough swab and we get a negative test, but you really actually have the infection, then that's going to be a huge public health problem for us. So, I think right now the nasopharyngeal swab is probably the best information we can get. But I think we're going to see other modalities crop up, and doing antibody testing with blood draws. That's going to be something that we're going to be doing more of as well. So it's a rapidly changing space.
Okay. Dr. Sands, two questions that are similar have come in. Patrick is asking, if you did get infected, should you continue to take medicines, or can some complicate the recovery? And Jean asked a similar one, are you more at risk if you do take blood pressure medication, for example?
So these are good questions. They've been looked at to the extent that we're able to based on the patients that have been treated. And there is not any good evidence suggesting that you should be careful about taking certain blood pressure medications. And people have asked similar questions about non-steroidal anti-inflammatory drugs, such as ibuprofen, Advil, naproxen, and those sorts of things. The problem with such a rapidly evolving pandemic is that there are lots of little reports of this and that, and it's really hard to put them together into really strong evidence. I think the issue about certain blood pressure medications came out of is mainly theoretical, based on the way the virus latches on to our respiratory tracts. And all of the organizations that give recommendations on these things, the American Heart Association, the European Cardiac Society, and so on, all these groups have said, do not stop taking your medications, because the evidence there is not clinical, it's not strong at all. And with respect to the non-steroidal anti-inflammatory drugs, which many people reach for when they feel, muscle pain, or they're feeling achy or feverish, again, the evidence isn't strong that you should not take those things. But I think if you're concerned about it, taking Tylenol, as long as you're not taking more than the recommended dose, is a perfectly fine thing to do. It may or may not give you as much relief as the non-steroidal anti-inflammatory drugs, but I think that can be safe. But many people are staying at home and drinking more alcohol than they usually do, which is not good. And it's particularly bad because it doesn't mix well with acetaminophen or Tylenol. And so that can cause actually irreversible damage to the liver. So we have to be careful either way. On balance, I'd say use whatever you want to use as long as you're taking the lowest possible dose.
Thanks, Doctor. A great one here from Jean too. How can you protect yourself if your spouse is exposed to the virus as an essential worker and they come home?
Well, yeah, that's a problem that many essential providers' families are facing right now. And I think that in some situations, they're setting up special rooms for these people, and they're making sure there's actually a protocol you can look for online about how they should enter the house, and how they should take off their clothes, and what you should do with their clothes. And I think that's, that's really the most essential thing to do. And then whether you want to additionally isolate them is, really up to you. And it really depends on the risk of the people in the house. If there's somebody who's immunosuppressed in that house, I'd be very, very concerned about that. There are even, and I'm trying to remember where this was that I was reading about. I think it was in New York, maybe, where hotels who are now, that are now mostly vacant, are like giving hotel rooms to healthcare professionals who have to be at the front lines, who are exposed to coronavirus, to keep their families safe.
Great, thanks, Danny. I got one here from Sherry. Is there any indication that people with well-controlled asthma could have a mild case or is it always going to be severe?
You can definitely get a mild case.
Oh, good.
Controlled asthma. And I think, most well-controlled conditions, or things that you had in the past or whatever, are probably, as far as we know, are not conferring an extra risk for getting sick.
Marissa?
I'm on mute again. I have one here from Rose. She says that her neighbor pets her dog sometimes. Is it possible for him to either catch the virus or could the germs live on her dog?
Okay, so dogs, on the one hand, dogs don't get sick with this virus. So you don't have to worry about that. But on the other hand, the dog is a surface. And like any surface, it can, contain viable virus. We don't know if people can get sick from that, just like the other kind of surfaces I was talking about. But yes, it is a potential. So if you have somebody who we know has coronavirus, excuse me, I'm not sick, I was just choking.
Right.
If we have someone who we know has coronavirus and they haven't washed their hands and they might have been, rubbing their nose or blowing their nose or sneezing or coughing into their hands, which you shouldn't do, and then they touch the dog, well, yeah, there's going to be virus on that dog. And so I think it makes sense to, they should be careful. Anyone who's infected should be careful. But of course, we know some people are infected and we don't know it because they have mild symptoms. Excuse me. And then the other person is that anybody touching the dog, anybody not infected touching the dog, should be careful, and they should wash their hands, for at least 20 seconds properly after they've touched the dog. And then the other thing, in general, this does not just apply to dogs, but we've got to learn, and this is really hard, to stop touching our faces, which we do something like 20 times a minute. Mm-hmm. And it's hard to learn that. It's like you need to be a yogi or something to not do that. I remember when I was in high school choir, we had a really crazy and intense choir director. And one of the things he made us learn is how not to touch your faces. Because when we performed, he didn't want anybody touching their faces. They wanted to look like a uniform choir with the black robes and anyhow. The point is that it was really hard, but now it actually comes in handy that I learned how to do that. But it is very hard because we do touch our face a lot.
Well, to that point, Jennifer has asked, what's your perspective about wearing a mask? Everyone infected, or just the clinicians and the first responders?
All right, this is an area of hot controversy right now, and I'll tell you why. So, if you are so first of all, let's take the easy case. If we're talking about a person who is infected with the coronavirus or may be infected with the coronavirus, that person should definitely be wearing a mask when they go out. Okay, so now let's get to the other cases, which is where, well, should I go out when if I have to go to the grocery store, should I wear a mask so I prevent myself from getting sick? That is the area of controversy, quite honestly. So if you're going to be in harm's way, you're going to be taking care of people with respiratory symptoms or whatever, or any patient for that matter, you probably should wear a mask to be safe. But we have to recognize that it's not like these particles are just floating around in the air everywhere. These are particles that are expelled by people who are sneezing or coughing. And so, so most of that exposure would come from the sneezing or coughing. And so if you're not, close enough to someone, let's say within 6 or 10 feet of someone who is coughing or sneezing, then you could argue that you don't really need a mask. If you're immunocompromised or something, yeah, you probably want to be extra careful. But there is some data, theoretically, that people, even when they're talking, some particles go out. So you could imagine a situation in which someone is talking and they're infected and they don't know it. And as they're talking and maybe spitting a little when they cough, that there could be virus there. And so the people who are advocating for universal masks are saying, well, because of that, we should all be wearing masks to prevent us from getting, inhaling one of these particles. I think it's not a very strong argument. The other argument is that people who do wear masks right now some people would say are stigmatized. Oh, that person's sick, or oh, that person's immunocompromised. And so some people are saying everyone should wear masks, so we destigmatize this. So, I will tell you, there is no standard protocol yet. Right now, the World Health Organization and the CDC do not recommend universal masking. Personally, for the reasons that I mentioned, I don't feel it's necessary for me to be masking when I go to the supermarket, but obviously I keep my distance from people. I don't want to get close to them. And I personally believe that we should be more careful about preventing people from going into stores who are obviously coughing or sneezing.
Okay, last question here, Danny, Dr. Danny. I know you have to go. You've got an 11:30 appointment, and we're at that time. Just very quickly, is there any way? Well, first off, someone asked, "Do you have any tips from your choir about not touching your face?" Do you anything want to? And also, just
it was when our choir director Ed yelled at us if we touched.
Getting yelled at. Okay.
That was it.
And just in general, is there any way overall you're seeing ways to handle the anxiety in general? There's so much, Kimberly asked, there's so much we don't know yet. How do we know it's not on frozen food if it's still not in the data yet? Any way to just generally handle the anxiety we're all feeling?
That's a really great question to end on. And I see in our patients, in my patients, so much anxiety right now. I see it in my friends and family. I see it everywhere. And part of the anxiety comes from the fact that, oh my God, the whole world is shut down. And it's depressing, right? And people are losing their jobs, and so that causes a lot of anxiety. Some of our listeners may be losing their jobs. It is really a hard time. So there's a lot of reasons for anxiety, and then on top of that, we have so much uncertainty with respect to this illness. It's very serious. When we don't adequately flatten the curve, as we've seen in Italy and in New York and other places now, we have an overwhelmed healthcare system. And we're making difficult choices about who gets to go on a ventilator. And all these things are anxiety provoking as well. And we need to understand that you got good reasons to be anxious. There's a lot to be anxious about. But I think that it's important to put things in perspective. So first of all, we need to identify our anxiety. We need to name it, and we need to deal with it, right? We need to confront it. And we need to understand this is a totally rational thing, that there's a lot we don't know. There's a lot of terrible things going on right now. And so that's important. And we also need to put things in perspective. And that's why I was talking about, you're not going to go out for a walk and catch coronavirus if you're staying away from people. So that's important too. We can't just be totally paranoid all the time. But I think we can also do a lot by reaching out to friends and family, by the phone, or by using any of these video tools that are available, even if it's just FaceTime or it's Google Duo or Hangouts or whatever, because these social contacts become very important, and it's a way that we can keep ourselves from feeling isolated, and we can manage our anxiety. There are also a whole host of apps that we can use, many of which are free for a limited time. I won't go through them all, but you've heard about them: Breathe, Headspace, 10% Happier. There are a whole bunch of them. And there are websites that help you with this as well. And these will help you get centered. And then beyond that, it's about, getting your mind out of this. Don't sit there staring at your navel and saying, oh, woe is me, this is terrible, and I'm so anxious. Do something to get your mind off of it. Whether it's listening to music or reading books or listening to books or cooking or running, any of those things are really important. People have done incredibly creative things as they sit in their homes, not able to go to work. So those are the kind of things that you really should do. You should sublimate this anxiety and do something that is productive and takes your mind off of it.
Well, Dr. Sands, thank you very much for your time today. I know you have to get back. You have a patient waiting probably, and I really respect your time. And I certainly think on behalf of the whole team and the community, thanks for all your answers today. Folks, if we didn't get to your question, we are collecting them, and we'll be posting answers if we can in our shortly afterwards. We are going to send a link to you with some of the links that we mentioned, and we'll send an email with all the links that we mentioned. We'll also have a little survey in there. Let us know if there's more you'd want out of a webinar like this. Would you like another one? What's a good time, et cetera, et cetera. Dr. Sands, thank you so much. Marissa, by the way, everyone is finishing up her quarantine after traveling. So thank you, Marissa, for joining. Best of health to you all, and everyone in the community, best of health. Thank you so much for joining us. And stay safe. Okay, bye-bye.